board. And it's great. We have a handful of practitioners here tonight, and then we also have a big group of folks who registered that are just interested in learning more about pediatric health, pediatric nutrition, eczema, how to support family members, how to support, friends, how to support themselves. So we've got a nice mix. So I think Corinne's going to try to target not only the practitioner tonight, but also, the consumer, just the lay audience who's looking for information and education. Just to introduce myself for those of you who um, this is your first time joining us. We do this every Wednesday. I'm Dr. David Fuse. I am a doctor of clinical nutrition. I am the department chair at Purdue Global. I own several companies, and I've been doing this in the nutrition industry for 6 or 7 years now. Before that, I was military, and so I used to mentor Corinne, and now I go to her with all of my eczema clients and I ask her questions, and all of my pediatric clients I just send to her. She knows it way better than I do. So we're super pumped to have Corinne chat with us tonight. And the way we typically do it, I'm not sure Corinne can step in here in a minute when I pass it to her, but put your questions in the chat. We'll get them as we go, or Corinne will stop and we'll kind of like review the questions and then continue, or we'll have questions at the end. I'll let Corinne decide, but I can help moderate the questions. But yeah, we're super pumped to have Corinne here. Corinne, you want to introduce yourself?
Yeah, so my name's Corinne, and I'm a nutritional therapy practitioner, restorative wellness practitioner, and oh, I think we're on mute.
Yeah, guys, can you mute yourselves?
Thank you.
There you go. Perfect.
Oh, I muted myself now. I've been working with kids in the nutrition field for 3 years now. And it's just been so rewarding. It's such an amazing career, just helping people and really addressing root cause rather than just, band-aid solutions. And we're going to get into all of that stuff tonight. So I have a lot to go through. So yeah, if you're good with that, David, I'll kind of just jump right in and start.
Yeah, let's do it.
Let me share my screen here. All right, present.
As you're setting it up to Corinne, you've got one of your former clients on here as well, and
Mhm.
Paige, who you inspired to pursue a career in this field. So,
Oh,
we
I
got,
love it.
yeah, we got a nice mix of folks tonight. But yeah, go for it.
Okay, cool. So, I'm going to be talking about the pediatric microbiome and an eczema case study. So, a lot of what I'm going to be talking about is very geared towards allergies and eczema, but honestly, this can be applied to any and all health issues for children. A lot of things overlap, of course, and a lot of the imbalances overlap, but there really is just such a lack of answers in pediatric care and so much overprescribing when really what it comes down to is gut imbalances and nutritional support needed. So, yeah, that's the amazing thing about working with kids. For those in the mentorship here, if you are looking for a good niche, doing anything with kids is so rewarding. It's so fulfilling, and kids are just so quick to respond to interventions. So it's a great field to go into. Our children truly need our help now more than ever. 1 in 5 children has eczema. It's steadily increasing. 1 in 12 has food allergies. The Maha Commission report just came out and said that I believe it was like from, I don't know, 1990 to 2018, the prevalence of food allergies has increased 88%, which is like astronomical. 1 in 11 has asthma. 1 in 3 has food sensitivities. 1 in 80 has celiac disease, which has also like fivefold increased in the past 20 to 30 years. 1 in 5 has mental health and behavioral impairments. 1 in 4 has recurring ear infections. So the list goes on and on, honestly, but you get the point. We're obviously in a chronic illness crisis for our children, and there sadly are no lack of children that really truly need this help. Um, so factors that disrupt diversifying of child's gut. Diet, of course. So breastfed versus formula fed, the introduction of solid foods. I'm going to be going over a lot tonight, but we're going to touch on like how the gut should develop kind of from birth on, because that's really important to lay the foundation for health long term. But so breastfed, formula fed, solid foods, lack of fiber. That's a huge one for kids. Very few kids are getting enough fiber in their diet. Dairy and grains are pushed as the first foods for children and for babies, and dairy and grains wreak havoc on the gut, especially when kids already have a leaky gut naturally. That is doing no favors. Mode of delivery has an impact on this. Obviously, C-section versus vaginal versus interventions, that all has a big impact on the gut microbiome. Antibiotics, vaccinations. I think there's up to like 30 vaccinations before kindergarten, hospitalizations, siblings. They say the more siblings, actually, the better, the more exposures of different bacteria and diversity, gestational age at birth, medication exposures, and toxin exposures. Toxins from water, from the air we breathe, mold, personal care products, toxins from food. I could do a whole presentation just on toxins, and David, maybe you can have me back to do that. But toxins impact children on a huge scale because their tiny little bodies cannot tolerate toxins the same way adults can, right? They have immature immune systems, immature detoxification systems, and they just can't quite tolerate it the same way. So toxicity impacts them a lot. Additionally, kids have, I want to say it's like 30% thinner skin than adults. So they absorb toxins 30% more than adults do. So that's why it's a huge, huge issue. Another thing I wanted to touch on is microbiome imbalances passed from mom to baby. That's a huge one. A lot of my clients will come to me and they live a very non-toxic lifestyle. They had a picture perfect vaginal birth, no interventions, took care of themselves during pregnancy, and their kid is still struggling with issues. And that can tie back to in microbiome imbalances and toxicity being passed from mom to baby. This is an image that a lot of you are already familiar with. It's kind of the total load theory. So the cup of inflammation, and it's basically the concept that we all have this internal cup and we can only tolerate so much. And when our cup exceeds the exposures exceed what we can tolerate, we then overflow with symptoms. So this excess inflammation cup, this is basically showing when we are full to the brim and any little thing is going to push us over the edge and put us into a flare. So really the goal is to lower this cup, lower the total load of the body so that we can be more resilient and just tolerate the world that we live in better. So this is basically describing how we have our genetics and they interact with all of our exposures, the food we eat, environmental allergies, environmental toxins, infectious disease. When I say infectious disease, I really mean microbiome. This is an image that I took from an integrative pediatrician that I mentored with. Um, and stress. Stress is a big one that's overlooked too. So the goal is to get to this state where we have minimal inflammation and then we can tolerate life. We can tolerate a virus. We can tolerate pollen season. We can tolerate a cupcake at a birthday party and not have a massive consequence from it. When should you test the microbiome of a child? So I use microbiome testing a lot in my practice. It's such a great tool for most children's health issues. It can help to learn more about kids with eczema, allergies, asthma, so anything immune driven. Loose stool, constipation, gas, bloating, abdominal pain, mood and behavior issues, loss of appetite, food aversions, picky eating, all the common childhood things. Um, and for babies, So you really ideally don't want to test in infancy just because the gut changes so rapidly in infancy. So if you're doing a stool analysis on a 2-month-old, by the time you get the results back when they're 3 months, you're looking at like an entirely different landscape. So it really should be reserved for very unwell babies. I do it on some babies if parents are really desperate and needing answers, and it can be helpful, but generally speaking, a couple months into life would be a better time to do testing. Common microbiome imbalances in kids with eczema and allergies. So low digestive function, low butyrate production, bacterial and fungal overgrowths, and low commensal bacteria, specifically bifidobacterium. That's a huge one that we want to see very populated in a child. So I'm gonna go through each of these four in detail and what all that means. And secondarily, we see a lot, if not all, with depressed or hyperimmune function and a lot of inflammation in kids. Digestive dysfunction. So this is a huge one in children. Digestive dysfunction is very, very common, and I'll explain why on the next slide. But so measuring fecal elastase levels can provide insight into pancreatic function. Low levels may indicate pancreatic insufficiency, where the pancreas does not produce enough digestive enzymes. Often low levels of elastase will be seen in children, and often even undigested food in the stool will be reported by the parents. And that's a really big red flag that the child is not absorbing their nutrients well, right? They're not digesting, they're not absorbing. A study was published in the Journal of Pediatric Gastroenterology and Nutrition indicated that some children with eczema had low fecal elastase levels, so suggesting a potential link there between pancreatic function and skin health. So, which is interesting because that's something I have seen as well in my practice. Another common digestive dysfunction seen is insufficient biliary function. So, bile is what we produce in the liver, store in the gallbladder, and then excrete during fat digestion. And toxins are heavily excreted through bile. So when someone is not excreting, the liver is backed up, there's a lot of toxicity, there's not healthy fats in the diet. Toxins will try to come out the skin as a last resort, right? If they're not getting out that way, they're going to have to get out some way. So that's where we'll see it come out through the skin. Additionally, where we have fat malabsorption, we will have fat soluble vitamin deficiencies, which also has a big impact on the immune system. So why do kids have poor digestion? There's so many different reasons, but some of the things that we can control are the distracted eating, not chewing thoroughly, not sitting at the dinner table. Baby-led weaning is a popular trend right now where babies will eat like large chunks of food and not chew it, not, actually break it down in their mouth. And that is a digestion nightmare. So that is setting up the stage for very poor digestion, inflammation, feeding bacteria where it shouldn't. And it's not something that I recommend. So yeah, it's never too early to start teaching our children these techniques of just getting parasympathetic before meals, slowing down, chewing thoroughly, setting the stage at least for healthy digestion. Poor digestion has a downstream negative effect on the rest of the gut microbiome. So this is where we see digestion as a big picture issue, and then we'll see other trickle down issues. So bacterial overgrowths like staph and strep, which that we'll get more into in later slides. We'll see nutrient deficiencies as well. So vitamin D, zinc, magnesium, B vitamins, vitamin A, selenium, vitamin C, omegas. This puts even more stress on an already stressed system, right? Because we're missing the raw materials that our system needs to function. Butyrate. So this is a big one too. Butyrate is a short chain fatty acid that has been shown to exert anti-inflammatory properties and effects by inhibiting the production of pro-inflammatory cytokines and promoting regulatory T cells. This can help mitigate the inflammatory responses that we see in eczema and allergies. So, looking at key microbes like Faecalibacterium prausnitzii and Roseburia can give us a really good indication of butyrate production in the gut. It's so important because butyrate is the master regulator of inflammation and also promotes food tolerance, which is so linked to eczema, obviously, and allergies and food sensitivities, all the things. So yeah, those with allergies and eczema and gut issues in general can always, well, benefit from a high fiber diet. High fiber foods are what is actually going to feed those butyrate producing bacteria. And bifidobacterium. So bifidobacterium produces acetate, which acts as a prebiotic fiber to feed the butyrate producers. Inulin is another great prebiotic source that can help to feed those butyrate producers. This is a great little image. I love this image that just kind of shows you the timeline of what we hope would happen from birth on in the development of the gut microbiome. So you can see here at birth, there's that big spike in the proteobacteria, and that's normal. That's to train the immune system of a newborn. And then shortly after, we see the bifidobacterium peak. So it's actually a good thing in a baby, like under 3 months, to see very little diversity. We want to see mainly dominated by bifidobacterium. And that's going to be heavily influenced by breast milk, the HMOs in breast milk. And if a baby is not on breast milk, formula-fed babies often may need support in that area. Once solid foods are introduced around, 6 months of age or so, that's where we really see the diversity come in, and that's where we see the Clostridia bloom. So solid foods, fiber, that's going to feed this. This is where the F. prausnitzii comes in and helps to produce butyrate. So this is kind of like the hallmark of how a healthy gut is set up. Bacterial and fungal imbalances. I know this is a very word heavy slide. So children with atopic dermatitis who are more likely to have food allergies often have increased colonization of Staph aureus on their skin. The compromised skin barrier can lead to sensitization to food allergens through skin exposure, highlighting a potential link between the bacteria and food allergies. Staph has been proven over and over to be correlated with food allergies and very much eczema. There was some Harvard study that said that like 99% of people with eczema have this like mutated form of Staph aureus on their skin. So that's something that needs to be addressed. And looking at, upstream at digestion, staph often overgrows in a low digestive capacity environment. A study with 718 patients showed SIG-E values correlated to clinical food allergy for peanut, egg, and cow's milk, which are three of like the most common allergies. They were associated with colonization of Staph aureus in children with atopic dermatitis. So the gut and the presence of healthy bacteria and the absence of these opportunistic and infectious bacteria is being studied as a future treatment option for food allergies, which is really exciting. Staph is a difficult one to overcome, and it takes topical support when it comes to eczema. It takes topical support and it takes internal support. So some topical staph supports can be calendula, oregano oil, apple cider vinegar, golden seal, neem, rosemary, silver. There's a ton more. These are just some of the more common ones. And then the internal staph supports. Bacillus subtilis is a spore-based probiotic that is shown to reduce the staph levels in the gut. Golden seal has great antimicrobial properties, oregano oil. And like I said earlier, addressing digestive dysfunction is key. We can eradicate, but if we don't fix the true issue, it will just come right back. Candida. So Candida is a super, super common one. Candida is the most commonly encountered human fungal pathogen. Symptoms can be so wide range, including eczema, food allergies, thrush, bloating, picky eating, behavioral issues, anxiety, sugar cravings, attention and learning issues, constipation, many more. Um, it can disrupt the gut-brain axis and contribute to inflammation, oxidative stress, and central nervous system dysfunction. Candida also produces gliotoxins, which are neurotoxic and immunosuppressive, promoting inflammatory cytokines. So the increased Th17 cells and decreased T regulatory cells make this a very important factor for anyone with allergies or eczema or other immune-driven condition. Candida has a big impact there, and I would say like majority of eczema cases may have some underlying candida issue going on and allergies. What causes candida? So many things. Candida is something that lives in all of us. So it's not that it's so bad, but when it overgrows, it becomes a big problem. So some of the causes of the overgrowth can be antibiotic use. When we kill out the good bacteria, obviously it leaves a breeding ground for yeast to overgrow. Gestational diabetes. So the higher your sugars, the more it's going to feed the yeast. So you'll often see that link there, gestational diabetes and either food allergies or eczema. High sugar diet, obviously, including grains, starch, anything that turns to sugar in the body, stress, immune deficiencies, and mold exposure. Mold and candida kind of go hand in hand. Supports for candida. So candida truly takes a whole person approach, right? You want to address everything about the child, but some supports can be avoiding excess sugar, grain, and starch, a protein, fat, and fiber forward diet, SIG-A modulators like immunoglobulins and Saccharomyces boulardii, stress techniques, so lowering stress in your life, managing stress, antifungal herbs like caprylic acid, golden seal, scutellaria, oregano, grapeseed extract, neem, rosemary. The list goes on. Um, Research suggests a connection between Candida albicans overgrowth and the exacerbation of atopic dermatitis, also known as eczema. Some studies indicate that Candida can colonize the skin of people with atopic dermatitis, contributing to increased symptoms. And elevated candida levels have been showed in the research to correlate with elevated IgE levels, so true allergy, which was the case with my son, actually. Bifidobacterium. So bifidobacterium is, as we already saw with that beautiful little diagram, how important it is truly in shaping the gut of a child. And we should really see in infancy bifidobacterium dominating. Bifido produces acetate, which translates to GABA in the brain, which is the calming neurotransmitter. So colicky, fussy babies may just not have enough bifidobacterium. Bifido produces prebiotics to feed the butyrate producers, like we already discussed on the previous slides. And this is crucial because, butyrate is so important for intestinal inflammation and promoting that food tolerance. The Klebsiella to bifido ratio is an early predictor of pediatric food allergy. So if we don't have enough of the bifidobacterium, then Klebsiella, which is a not so friendly bacteria, has room to overgrow, and that has been shown to increase the risk of food allergies. And additionally, studies show that inadequate bifido levels correlate with cow's milk protein allergy, which is so common in babies and children. Some of the more important strains would be B. longum, B. infantis, B. breve. There's a bunch, but those are more popular strains for eczema. Supplement supports for kids. So I use a lot of supplements in my practice because nutrition alone can really do wonders, but supplements kind of take it the extra mile and can really help to support the overall imbalances in the gut. So some of the more common things, I won't go through like every single thing on here, but you guys can access my slides and see all of this. But commonly I'll do digestive support, right? Like little digestive chewables or powders. Um, Pre and probiotics can make a huge difference in the gut for children. Some of my favorites are Probiomed Kids, Clear Labs Therabiotic, Megaspore Kids. Proflora 4R is a great one for those that are more histamine sensitive. Akkermansia is a great little strain that I use actually a lot now. Um, I'll talk more about that in my case study. GI repair nutrients, immune support, vitamin D is so important. Sac Boulardii and immunoglobulins can be really helpful to just strengthen the immune system, make it stronger, let it do its job on its own, and mushrooms. Inflammation support, antimicrobial support, and liver support. I do use liver support often. If you guys have any questions about this, just drop it in the chat because it's a lot. And then Clark's rule for dosing. So this is a great way to figure out pediatric dosing. So if you're someone that's wanting to work with kids and are like, I have no idea how to dose, how to give supplements, this is kind of a rule of thumb. You can use Clark's rule. So Clark's rule is an equation that's used to calculate pediatric dosage based on the known weight of a child and a known adult dose to be used. So Clark's rule equation is defined as the weight of the child in pounds divided by the average standard weight of 150 pounds of an adult multiplied by the adult dose, and that's how you obtain the pediatric dose. And I just gave a little example here. So an adult dose of mastica is 3 grams. A 50-pound child would take 1 gram because we're taking weight of the child divided by weight of the average adult times adult dose equals pediatric dose. So that lands us with 1 gram. And you can use that for most supplements. Okay, and then eczema case study. So I thought I'd just put everything I just talked about into action here. So this is a case study about a 7-year-old little boy. He had severe eczema, multiple food allergies, and he was on Dupixent for eczema management. Dupixent is a medication that's commonly given in conventional medicine for eczema, and it basically blocks certain inflammatory pathways in the body. So it's truly blocking the root issue. The mom obviously, and we have to do what we have to do for our kids. No one wants to see their kids struggle. So no shame there whatsoever. But so the mom really wanted to get to the root cause. So that's where she reached out to me. A little bit about the history. Mom had gestational diabetes in pregnancy. So I already had, those yeast issue raising in my head. Itching and sleep was a big problem for this kid. He was very itchy, and that was obviously disrupting his sleep. And that disrupts the whole family. He was taking Mama Llama pre and probiotics when they came to me. Diet was sourdough with avocado for breakfast, birch bender pancakes, fruit. Lunch and dinner was chicken or beef with rice, chicken nuggets, broccoli, protein pasta. Overall, they lived a very low tox lifestyle. They checked their home for mold. They had no carpets in the home. They were using air purifiers, so there were no major like home eczema triggers. Here's the kiddos' labs. So as you can see, so H. pylori looks normal. These are in normal range for a child. Commensal bacteria, you can see a little bit of dysbiosis happening here. Some good things, bifidobacterium looks great. Lactobacillus looks great. Those are really protective bacteria. We see Akkermansia at under detectable limits, which at his age 7, we would definitely want to see that populating by now. So we'll come back to that. Opportunistic microbes, so you can see a little bit of dysbiotic overgrowth happening here. The Enterococcus, Staph aureus, Strep. So these 3 right here are raising the digestion red flags, right? Because these will often overgrow with poor digestion. And then Candida down here. So Candida is flagged high, and if you're familiar with stool testing, Candida very rarely comes back positive on stool. So when it does, you know it's kind of a bigger systemic issue because it doesn't usually get picked up in the stool. There's other ways of testing that are more sensitive, but yeah, whenever it comes back positive, this is a high priority issue. Oh, I'm going the wrong way. And then intestinal health markers. So steatocrit looks good. This is the fat digestion marker. So no fat showing up in the stool. Elastase, this is pancreatic enzyme output. This is definitely suboptimal at 284. We would want to see that closer to like 500. So digestion is definitely needing support here. Beta glucuronidase looks normal, no blood showing up in the stool. Immune response is very upregulated. So what this basically means, when there's a high secretory IgA, it means that the gut immune army is fighting. So your immune system is at war. What is it fighting? That's the big question. Could be food, could be bacterial and fungal overgrowths, which is what we're seeing here. So it's really about addressing what's driving that immune dysregulation. Antigliadin looks good, EAP looks good, and calprotectin looks pretty good for a kid. Um, those are pretty low levels. So the recommendations were as follows. Diet, he was already dairy free, so we did 100% gluten-free diet for 3 months. Smoothies for breakfast, that's a great way to make transitions for kids into having more whole foods, more berries, more vegetables. You can, throw them in a smoothie and make a really nutrient-dense meal. So we did smoothies with berries, flaxseed, chia seed, coconut milk, avocado, spinach, etc. Protein, fat, and fiber at every meal. And supplements, we did Transformation makes a really good little kids chewable digestive enzyme. So we did that for elastase support. Hawaii Farm makes good herbals for kids that are non-alcohol based. So we did Scutellaria, which is a great antifungal that's fairly gentle for kids. Supreme Nutrition takes Sumi. This is a binder. BioRay NDF Calm is a great liver support. I love that supplement. It has milk thistle, which is an antioxidant for the liver. It has a little bit of chlorella, which also acts as a little bit of a binder and a liver support. It has some mushrooms in it and adaptogens, so this is a great little formula here. Saccharomyces boulardii to keep the candida levels in check. Obviously, we're doing the antifungals too, but this can add as another secondary level of support. Immunoglobulins is basically dairy-free colostrum, and that just gives fuel back to the immune system so that it can fight better, antibodies. And then we did pendulum akkermansia. Akkermansia is a great strain because what it does is it actually eats the mucus lining in the gut. So as it eats the mucus lining, it tells us to regenerate more mucus, and that protects the barrier. It protects the mucosal layer, which keeps things in the digestive tract where you want them to be, not seeping into the bloodstream. The mom was so kind to let me share his picture. So as you can see before, he had a lot of inflammation around the eyes, around the mouth, and this is the after. He's looking so much better. Sleep is better. Everything all around is better. They were able to pull him off of the Dupixent medication, so he's no longer on medication. And yeah, that's the power of nutrition with kids. I know that was a lot, but I'm ready for any questions you guys have, and you can always email me. Here's my email, and follow me on my Instagram account. I post a lot of good information there about allergies and eczema too.
That's awesome. I'm glad the mom, as many of your clients let you do, she let us see the before and after picture. Those are fantastic, Corinne.
Yeah.
You've got a couple, not just a couple. You got some good questions, quite a few in the chat. If you want to go through that first.
Okay, yeah. Let me stop my share really quick.
And I think, I mean, unless another company has blossomed, Pendulum is the only company that offers Akkermansia still. Um,
Yeah,
so it's really hard to find Akkermansia in supplement form.
yeah, it's true. And it's fairly new. I think it's
Yeah.
only, what, like 3 years old or something?
Yeah, it's basically the newest strain of bacteria that we've researched and that we're trying to, figure out more about. What you can do if, if a client doesn't have the funds for Akkermansia through Pendulum is Akkermansia eats polyphenols, so you could just feed your body's natural Akkermansia. You could just feed it to produce
Yeah.
more, so just green tea and stuff like that. But go for it, Corinne.
Okay. Hey Paige. One question I'm hoping to have answered in this session is with severe food allergies, what are considerations to determine diet elimination versus exposure therapy? Okay, if I'm understanding that correctly, you're asking me if someone's allergic to something, should they be avoiding it or should they be exposing in low amounts? Is that correct? So if that's the case, my answer to that is always from the functional perspective, we want to remove what's offending the system. That's the first step in getting the gut right. It's tricky because there's, obviously the fact that early allergen exposure can reduce long-term risk of food allergies, but for people, especially with eczema, they're already at a greater risk for food allergies. So, what I always do is work on getting the gut in a better place. Give it, 12 weeks, 12 weeks of getting the gut better, healing the gut lining, and then start doing some exposure therapy. You'll have a much better response and just reduce that inflammation and potential tissue damage. Would you expect foods high in insoluble fiber to appear undigested in the stool, or is that abnormal also? You shouldn't really see undigested food in the stool, so I would say it's probably a red flag if you actually see it. And maybe doing a stool analysis could give more information as far as from digestive perspective, what's going on there. Do you have a recommendation for resources to guide starting solids that are not baby-led weaning? Yeah. Um, Message me or email me and I can help you with that. I do this with clients. I help them with starting solids. I have a lot of like baby infant clients. So I can help you with an eating plan and all that good stuff. So yeah, just reach out. Do you ever recommend topical probiotics for the skin? Actually, I have. I've never recommended like opening a probiotic capsule and putting it on, although I'm not opposed to it. Maybe that could be helpful. Maybe that should be a good invention, but oh gosh, what is it called? I want to say it's like Sieve serum. It has some probiotics in it. It's like a serum, and that has actually helped one of my clients a lot. So I think it's called Sieve, CIV or SIV, something like that. Thank you, Yvonne. What if you have Staph aureus overgrowth on skin and staph in the gut as well? How to get rid of it? Also, possible nose colonization. Adenoids swollen and sinuses always clogged. Any particular golden seal you recommend? So I listed a couple things in the slides. You do want to address both. You want to address from the gut perspective and you want to address your skin barrier because if the skin barrier is broken, it's going to cause gut dysfunction and vice versa. It's like that never-ending cycle. So, to address it on the skin, you can do different things. You can actually do things like golden seal on the skin, make like your own little salve with it in it. You can do apple cider vinegar diluted on the skin. There's a couple of different strategies. Hypochlorous acid is great too. It's super gentle. It's something that's produced by our own immune system. And it sounds harsh, right? Acid, but it's so gentle. It's a natural antibacterial and it works wonders at reducing staph levels on the skin. So I highly recommend hypochlorous acid. It comes as the brand name Briotech on Amazon. And the nose colonization, they do make nasal sprays, right? Like that Xlear Kids. That's something you could possibly do some research on and see if that would be a good fit. But yeah, for adenoids and sinuses always clogged, definitely want to look big picture at what's going on with exposures in the environment, what's happening with the gut, calming histamine reactions, all of that. Can you recommend safe antiparasitic herb supplements for a 1-year-old with eczema? Yeah, so BioRay is a great company that makes supplements for kids, and they have BioRay Happy is a good one. It has black walnut in it. So that is very antiparasitic. It has a couple different herbs. It's like a little tincture, and it tastes like fairly good for kids. So always do with caution in a 1-year-old. Go super slow if that's something you're wanting to look into. You may want to be guided by someone while doing something like that. Supporting liver, addressing the diet, addressing the whole big picture, not just going after parasites. Can Candida overgrowth lead to IBS or IBD? There's a lot of research linking them for sure. And sometimes people will get those diagnoses and it's not truly that. It's really just gut imbalances, possibly something like a Candida overgrowth. So it's definitely worth exploring. How do you test for bifidobacteria? Yeah, you can do a GI map, GI spotlight, GI effects. Any comprehensive stool analysis can show you your bifido levels. You can even do a tiny health. That's a self-order test, and that will give you a good measure of your bifido levels. What are safe grains to introduce to a kid on a grain-free diet? Do they have to be soaked, fermented, sprouted? So if you're going to do grains, yeah, you want to do them right, prepare them properly so that they're easier to digest. Um, Maybe something like rice or quinoa, depending on the kid, could be a good slow start into grains. So what made you choose to do liver support with this case? That's a good question. So we did liver support because I want to say this child had tried antimicrobials in the past and had a bit of like a detox reaction, a Herxheimer reaction. So, whenever you're killing bacteria in the system or candida, it die off can happen. It can release toxins into the body and almost seem like things are getting worse. So, adding in a liver support or a binder can reduce that, right, to help filtrate out the toxins. Should an infant avoid gluten if the mom has gluten allergy or celiac disease, non-celiac gluten sensitivity? So I would never be giving an infant gluten to begin with. And if there's already a heightened risk, I wouldn't be doing gluten just because of the impact on the gut. It's not to say the child could never have gluten. That's certainly not the case. But in those early months of life, you want to be focusing on nutrient dense food, plant foods, legumes, quality proteins, fiber, all of that, fats. Bless his heart. Yes, he's seriously adorable. If a toddler needs antibiotics to manage an infection, how do we best ensure their microbiome is minimally affected? Yeah, so you may want to do proactive probiotics and taking it away from the antibiotic. So if you do the antibiotic in the morning, do some probiotics at night. If your child's already on a probiotic, you could possibly increase the dose, right, to get at least balance out some of the effects. And you're going to need longer term support for sure. I would wait like a month or so, do a stool analysis after antibiotics, see what the damage looks like, and support accordingly. Saccharomyces boulardii is a great supplement for kids that has just so many benefits, um, including post antibiotic use. It can help to reduce candida growth after antibiotics. Can you remind us lack of bifido is related to dairy allergy? Yes. Oh, Melissa, you are here. It's sieve serum. That's funny. Yeah. So that's the probiotic serum, sieve serum. Sorry, I'm skipping around. So yes, bifido is related to cow's milk protein allergy. Low bifido levels are linked to that. Do you recommend kids taking raw cow milk after they build up mature immune systems? I used to swear by raw milk until it gave me E. coli. Wow, we need to hear more about that, David. That
Yeah,
seems
just be careful. I mean, there's a lot of benefits. Historically, it's been used for quite a few reasons, for all of the live enzymes in there and immune supporting, nutrients and things. But you got to be careful with your sourcing. Um, don't just go to some hick farm. You know, I drank it. I think I drank about a half gallon of raw milk through college daily half gallon.
oh my
And I
God.
mean, yeah, it really, I think a lot of guys on my basketball team, I played collegiate basketball and we put on, a good amount of weight with weightlifting and all this raw milk. But then the only thing I did, it wasn't like I was eating beef or something like that. At that time, yeah, I got E. coli. It was probably from the milk. Yeah, you got to be careful.
I've heard it before,
Yeah,
so that's super interesting. Um,
but a
yeah.
lot of benefits though.
Yeah. Is it worth trying to do a protocol and food elimination with older kids if you can't do it 100%? They have multiple food allergies and some other things. I ask because they are 10 and 15, so I don't have as much control over what they eat these days since they are gone more. Yeah, that's tough. Anything you do in a positive direction with nutrition is gonna be beneficial. You don't have to go all in, all or nothing to see results. I mean, no one can follow anything 100%. There's always going to be some variable there. So I would say it's absolutely worth trying. And you may be surprised at how much progress can be made just by small changes.
Yeah, a great place to start for folks is just food swaps. I often tell new practitioners that I'm mentoring is it's a great place. Any client you're working with is if they're having soda, switch them to seltzer. If they're having chips, switch them to nuts. So just like small tweaks in your life and your kid's life, they'll go a long way if you stay consistent with them.
Yeah, definitely. Definitely. Um, Tips for the itch. Yeah. So itch is really complex because everyone's itch is driven by their own unique cause. But managing the skin microbiome is important. So some of the things I talked about earlier, like maybe the apple cider vinegar, you can even do like a little oregano, right? Control the staph levels on the skin that can help with itching. There's also Cometis cream, Cometis with a K. It has sulfur in it, which is very anti-itch for the skin. That's something you could try, but you really want to address the true deep-rooted issues. Histamine is often driving itch. So what's driving histamine? Is it candida? Is it mold? Is it environmental allergies? You know, really addressing the whole big picture. Any recommendations on safe mineral non-nano zinc oxide sunscreen for babies with moderate eczema heading into summer? Yeah, sunscreens are tough. I like the Badger Baby and Babo Botanicals. Or those are usually my two recommendations. I don't know that it's non-nano zinc, but yeah, it's a low tox. It's a pretty good. If a child has cow's milk protein allergy as a child and GI symptoms resolve with elimination of dairy, how would you still assume bifido may be low?
I meant
Um,
to say he had it as an infant.
okay, so an infant had cow's milk protein allergy
Yeah.
and the GI symptoms resolved with the elimination. Would you still assume bifido may be low? Probably not. Maybe it resolved itself,
Okay.
especially if they're tolerating dairy now. Definitely.
Yeah.
It's possible, it's still a clue, right? And kids may change as they get older. So testing is the only real way to know, of course.
Right.
Yeah. In a toddler with many GI sensitivities and eczema, could a high fiber diet be contributing to constipation? It can. Fiber can be tricky. Whenever you're increasing fiber in the diet, you really want to go slow, increase hydration alongside of it. Make slow, sustainable changes, not just throw a bunch of fiber at once, because if the body's not used to that, and if there's certain microbial imbalances, yeah, you can see worsening of GI symptoms. So just go low and slow with it. And it could be a sign to dig deeper. I think I got all the questions.
Great, Corinne. Why don't you put in the chat, put your email so people can copy and paste it real quick.
Yeah.
And I know folks are going to have a ton of questions.
Any other questions anyone has?
Corinne, I think you skipped mine. Oh,
Oh my God, I'm sorry.
that's okay. It's all right. It's Paige here. Do you ever recommend digestive enzymes with the betaine HCl for kids? Peyton has been seeming to need a little bit more assistance lately.
How old is Peyton again?
She's 8.5.
She's a little too young. So they say you shouldn't really start it under the age of 12. So hey.
She wanted to say hi to you.
Aw, yeah. So, you know, you have to, it's your own child, so you can make that decision for yourself, of course, but we are told that under 12, you're not really supposed to do it, just because it's harder for kids to communicate like kind of what they're feeling in their body and if they feel that burning sensation with HCl. So I would just be super cautious about it, and maybe possibly wait and just stick with like digestive enzymes for now.
Okay. Oh wait. Yeah, we're low on the enzyme, so I was about to order something new, so I wanted to wait till tonight to ask you about that.
Yeah,
Yeah,
yeah.
I was just
Good
kind of
question.
wondering if her like H. pylori had crept back up or something, or her candida has gotten a little higher again. Just recently, her flares have just been a little worse.
Yeah, yeah. Well, it's been a while, so doing a retest could be a good idea just to get a new
Yeah.
baseline of where things are at now, because things change by the day for the kids.
Yeah, I'd really like to do that. I need to do that. It's expensive.
I know
Yeah.
it is. It
I know.
definitely is.
Yeah, Paige, chatting to you, I don't know when it was, maybe like 6 weeks ago. And I think you presented to the group, just like typical diet for Peyton and whatnot. The one thing that stuck out to me that you could play around with is that like big glass of orange juice every day, which the body, I tell folks all the time, they're like, oh, I'm having, like maple syrup. It's healthier, but the body reads sugar as sugar. And so
Hmm.
sugar can definitely drive some of these pathogens that are overgrowing. So it's something, you could do like half orange juice, half water to start and kind of like still give her a little sweet, but water it down a little bit. But
Yeah,
some,
she has a little, sorry, she has like a little glass, and I only do it well, it helps her take her fish oil, but also
yeah,
since she's dairy free, I just worry about the calcium, and I do get the calcium fortified one. So what other calcium stuff, should I give her?
my kids too. I know we're dairy free and it's like every day we bring up the calcium thing. It's like, Corinne, do you have any tips for calcium for kids
I
that are,
do.
yeah,
Please.
let's hear it.
So beans,
Yeah.
lentils, that's the best way to get calcium, to get protein, to get iron. Such a nutrient dense, amazing superfood. And you can like use them in creative ways. Like we make black bean brownies and like you can do stuff like that. Leafy greens too, right? That's a great way to get calcium. And I was always taught calcium is not hard to get in the diet. It's really the issue of absorption. So, like, your thought process is right. Like, how can you increase her absorption to make sure she's getting all the benefits? Making sure she's on a vitamin D to absorb the calcium too.
Okay, yeah, she is. Shut the door. Sorry. She's playing around. Sorry. Turn my sound on to talk to you, and now she wants to run around. Yeah. Okay. I know. Yeah, she just started on the L-glutamine too. David had recommended that was really good for the lining of the
Oh,
gut.
that's
Do you
great.
do that for your kids a lot? L-glutamine?
Not mine personally, but I do recommend it to clients often.
Okay. Yeah, we just started that, so I haven't really, it's too early to see any results yet.
Yeah, I just used a page, a client with acne and eczema, 16-year-old, and it worked pretty well. He needed to do a dairy-free diet, which he did, and then he had crazy leaky gut on the GI test.
Okay. Cool. Thank you.
Thank you.
Hey, Corinne, do you have an opinion on kids drinking kombucha by any chance? I had a pediatric patient she said he was just going nuts for it. We took him off it for a little bit because it was high glutamate and he was dealing with seizures and it was like an excitatory neuron. So I was like,
Yeah.
best just to avoid it. But even my 2-year-old likes it. But I'm like, is this too early to be dealing with those kind of bacterias? What do you think?
Well, the probiotic benefits are there, but I don't really recommend it just because most of the kombuchas, yeah, they're very high in sugar, and they can be excitatory. Also, the histamine, it's high in histamine, and that can provoke excitatory behavior too. So you were pretty spot on with the seizure kid, definitely with not doing that. So yeah, I don't generally recommend it, to be honest.
Okay, and even with kids that aren't dealing with gut issues or medical issues, you just wait until they're a little bit older, would you
If
say?
they have no issues, I mean, you don't need to worry as much. You can
Okay,
live life and, in moderation. I think that's totally fine.
okay, yeah, I just give it to my kid in like a shot glass.
Aw.
He loves it.
That's cute.
Okay, thank you.
You're welcome.
Great. Any other questions for Corinne? This is great, Corinne. Do you have anything else that folks might be interested in? Workshops, other webinars, just how to find you, anything like that? Your Instagram, I think you shared it earlier.
Yeah, so you can find me through email, through Instagram, my website, any workshops coming up, nothing planned, but follow along to find out.
That's great. And then for the practitioners on the call tonight, Corinne,
Yeah.
just, what tips do you have for, getting started, gaining traction in the field, and even some of the folks that aren't practitioners, maybe at some point in their life, they will want to pursue a career in nutrition. So this is really for everybody.
Yeah. My best advice is to just find something that you truly are passionate about and truly love and can relate to on a personal level. That will come across and reach people, and they will resonate with you and the things that you've been through. And once you start helping a handful of people, referrals will come knocking on your door. If you can truly help someone, that's all it takes to get your business started. Just like, do what you have to do to get your first couple of clients. Just put the word out there, tell your family, tell your friends, make an Instagram account, a Facebook account, however you want to get your reach out there. People don't know what you do unless you tell them. And then, yeah, just start helping people and then referrals will flow.
I love it. Any questions for Corinne on that front from our practitioners? Awesome. Well, we will send out the recording. Yeah, we'll get to that. Hannah put something in, Corinne, but we'll send out the recording over the next few days for folks that want to rewatch it, folks that came on late, folks that weren't able to attend, and we'll put Corinne's information in that email as well for those that want to connect with her.
Awesome.
Yeah, Hannah, where's your training in, Corinne? You want to give a little bit about your background?
Yeah, so my functional nutrition training comes from the Nutritional Therapy Association. I also did the Functional Medicine Coaching Academy. That's how I kind of started. I also did restorative wellness for more gut-focused training, and I got my board certification in holistic nutrition in 2023. There's so many ways to get into this field, and the NANP is a great place to start. They have a lot of different holistic nutrition certified programs that you can get into and, get your foot going in this career.
Yeah, the NAMP is great.
Mm-hmm.
Good. Okay, yeah. It sounds like, yeah, I chatted with Linda earlier. She put in the chat, she's going to email you some questions later, Corinne. I know she was
Sure.
excited to pick your brain about a couple things, but yeah, we appreciate it. We appreciate having you on and chatting, and we'll send out Corinne's information and the recording tomorrow or Friday.
Thank you guys so much. Thank you, David.
Yeah. Thanks, Corinne. All right, guys. Everybody have a good night. Thanks for joining.
Bye-bye.